Hi, welcome to Case of the Day. This is an experiment. I'm just trying to see if it's quickly possible to document at least one case that I see every day and just put it up as a YouTube video. So let's look at this one, why old scans make a difference. The 79-year-old with a long-standing history of interstitial lung disease presented for an opinion. And you can see here that there are reticular opacities. They show an axial distribution. This is a scan done somewhere else. There's also some amount of an airway component. And then you again see the axial distribution. You, in fact, see a hexagonal sign in the lower lobes, a lot of lucent areas. But you also see traction bronchiectasis at the periphery. So if you were to look at or put all of this together, you'd say there is a fibrosing ILD. It's non-UIP, non-IPF, likely fibrotic hypersensitivity pneumonitis, and there were some superadded areas of inflammation or infection. Now, the patient had an earlier scan from October 23, and more or less, there is no significant change in the scan features. But the patient had a scan from 2013, and this is an amazing scan because you see these ill-defined centrilobular opacities. Some of them are branching, most of them are not. So the branching ones would be an inflammatory bronchiolitis, but the non-branching ones represented non-fibrotic HP. And the expiratory images alongside show these patchy areas of widespread air trapping, and you see ground glass where these centrilobular opacities are kind of coalescing together to produce these areas of ground glass. No fibrosis at all. This is characteristic non-fibrotic hypersensitivity pneumonitis with extensive small airways disease. You put all of this together and it's amazing. So while in 2025 and 2023, if you just had to see a scan like this, you would say that yes, this is likely fibrotic HP, and you'd have to put everything together. If you have a scan that's 12 years old, which was non fibrotic at the time, with typical features of HP, then life is so much simpler. Then you know that this patient had non fibrotic HP that progressed to fibrotic HP, and it's slowly progressive because there's hardly any change between 23 and 25. I've done a similar case at ctchestreview.com of another patient who progressed over 12 years similarly. But the take home is that old scans are like gold in such situations. And somehow, I've been seeing a whole bunch of younger radiologists just don't seem to give any importance to old scans. And this is where you can make so much of a difference by being able to put things together and come to a diagnosis. That's my WhatsApp channel, and that's the experiment. Today is day one, and I guess I'll try and do it whenever I can and then figure it out. Thank you.